We're different than obviously any of the other groups. We're not core funded. We're not affiliated with the government, or, well, we're now affiliated with the university, but that's a non-monetary association with the University of Toronto. We have a sister organization in Greenland that's similarly non-funded like us. That brings together researchers over there looking at the issues of health in the circumpolar context. This is our website. And one of the things, though, without core funding we've been able to do just these past few years with limited staffing that we've had, and running always like any other social economy organization to raise funds for the next year. But what we've been able to do is leverage a bit of that, bit of those funds to build, one thing, websites, databases, and assorted, and support other organizations in kind with their research needs. So we have for example, here our website. If you go to, just go through these. This is the website for the Circumpolar Health Observatory. One thing we have done is we've had a massive donation of books from our colleague and good friend, Dr. Q Young at the University of Toronto, and that's been the nucleus of a Circumpolar Health Library that we've been putting together, and that's housed at our new facility. We did get RF funding as well, and our office is down in Old Town. You can actually, if you want to go visit that, you're welcome to. The face is obviously, the siding of the front building is all being renovated because we were actually the building that got hit by that plane in September. So all that's coming along. It's being renovated again, just when the construction was done. But we have part of that library is a database, and then we're going to have a Statistics Canada data center installed there, and we're still working out if we're going to have a tech assistant to run the place. But that's coming along. We're supposed to open that a month ago, but we'll put that off into the new year. But anyways, we're issuing reports on various facets of circumpolar health, kind of a cross-comparative approach with all the different jurisdictions that circle the North Pole, including Russia and all the Scandinavian countries, Greenland, Iceland, Alaska, and Canada. Go to the next one. That's another thing we've done, and this is a totally in-kind support, that we built a website for the Oral Health and Aboriginal Child Initiative. That was the University of Manitoba project back in 2007. So that's another kind of freebie that we were able to offer, another really worthwhile initiative that needed a place to host as well as present their the data and the resources that they had collected covering the area of oral health and children. And so that's another place to go. If you go to Dechinta, there's another association that we've built with the Dechinta Bush University, which is a really cool initiative here, based here in NWT, and specifically, Yellowknife and Blatchford Lodge, which is where they host this kind of semester. This is, if you remember back in July, this is the place that Prince William and what's her name? Kate. Okay. I don't know. Anyways, that they visited. I hardly remember Prince William. Anyway, so they visited there, and Francois Paulette, one of our most respected elders here in NWT, took him out on the lake. And there's a rebuttal actually on this website. If you look in the news section of it, they rebutted some of the kind of way the press covered that event. Kind of like this kind of, well, anyways, you got to read it. It's very interesting. So that's one initiative that we've been helping along. Very, very worthwhile. Go to the next one. Well, this is just a framework for our different websites. Of course, we've been hosting the social economy research here in NWT. And this website, which will continue beyond hopefully will continue beyond the age or the termination of this project. We'll keep it up, and I'll try to see if we can update it with more of some of the additional findings that take place, and so to kind of wrap up. So we'll see. And then if you go to the next one, we're also the Secretariat for the Canadian Society for Circumpolar Health, which is the organization that brings together researchers working in the northern health field from across Canada. And so that's some of the things that we've been working on. It's not a whole complete list, but it kind of gives you a taste of what we can do with very limited resources if you're running really fast. So after all that, you tend to kind of get exhausted, so you need to recharge your batteries. So right now I'm on leave, so try to do my own work on my own PhD, but in the January I'll be back. So if you want, if we go back to the, and Bree of course is also affiliated with the institute, but she's moving on too. So we do have a Facebook account, which I try to update with interesting tidbits related to circumpolar health. Want to click on that button? And Twitter and YouTube and all the kind of social media stuff that I've been trying to stow as much of it, the interesting information that, but it's a very good source of information, so you can just add it if you don't like it if you want to from your Facebook account. So I think I'll leave there. I won't bore you with more and more details. So if you have any questions from all of us, any of us, please feel free to. Thank you.